Welcome to Healthcare Algorithm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Hi, everyone, and welcome back to Healthcare Algorithm. I'm Dr. Will Strimel, and today we're tackling one of the most urgent problems in healthcare, and that is clinician burnout. Despite waves of innovation that have been meant to make care more efficient, many clinicians feel that they're working harder than ever. More clicks, more clinical load, and less time with patients. So the question is, why does technology so often add burnout instead of relieving it? And what actually needs to change? So to help us explore that, I'm joined by Dr. Lillian Emlet. She's earned her doctorate of medicine from Thomas Jefferson University, which is from my hometown of Philadelphia, and is a practicing emergency and critical care physician, clinical educator, and executive coach. She is also the founder of Transforming Healthcare Coaching. Now in Pittsburgh, Dr. Emlet works at the intersection of frontline medicine, leadership, and clinician well-being, bringing a perspective from the highest pressure clinical environments in healthcare. Dr. Emlet, welcome to the podcast.
Thanks so much for having me. I'm super excited to be here.
Okay, so looking at your career, you are definitely someone, it seems, that likes a challenge. You know, you take care of the sickest of the sick when it comes to the emergency department or the intensive care unit, and now you're trying to tackle clinician burnout, which is something that we all know is a problem, but yet no one seems to be able to solve. So just maybe start with telling me and letting us know, how did those two worlds come together?
Yeah, so for me in the pandemic, I think I had the very first time I ever paused. Right. So I opened the COVID unit and I realized, I wondered, is this all it's ever going to be? Recycling my N95 and taking care of people who are guaranteed to die back then in 2020. And so I paused for the first time. Obviously, everything shut down, my academic stuff, all my national stuff, everything sort of slowed down. And I actually had the time to sit and think. I was also going through, at the same time, my mom had gotten sick. I was going through a divorce, all the things that happened simultaneously. And so for the first time when I paused and to get out of that situation, I needed a coach. I needed someone to be able to help me see more clearly who I was, who I am, where do I want to go, and where do I go when I've already hit pretty much everything that I've ever wanted to accomplish, right? And this happens, I think, for all of us in healthcare at different times in our careers. Sometimes it happens earlier, sometimes it happens later, but at some point you hit the expertise plateau. And I now know, having done much more advanced training and coaching, that there is an adult developmental journey that happens where beyond expertise is innovation. And so to become a visionary, to become beyond sort of just being able to know everything you're supposed to know how to do, there is that next step up. And that's where coaches help. And since, I've been developing people for 20 years, all of my fellows, all of my trainees, all of my other, mentees, they're all now, division chiefs, chief medical officers. They've all gone on to do amazing things. I realized I've actually been developing people for a very long time. And so what better to do than to actually make that my new profession, being a coach.
So, we're programmed as clinicians to be sort of some at times invincible or very sure of ourselves. I have to imagine, and I'm sure you see this too in your clients, that taking that step to even ask for help is probably a big step to sort of admit, okay, I need someone else of my peers to help coach me. So, I mean, maybe your experience yourself, if you'd mind sharing, but also how do you kind of see that people who finally get to that point where they feel ready to ask for that?
Yeah, so I think there are probably two flavors. One is the fact that you just sort of waded out by accident into the deep end, and you look around, you're like, I have no one to help me. There's no life preserver. My mentor isn't exactly the right fit. I don't have a board of directors that can help me, right? Because if you've been properly mentored, you have actually a team of people who support you in different ways. And sometimes they're just not completely the right fit because of your own unique journey. Because as we become different leaders, different positions, different unique paths to get where we get, either in academics, private practice, or entrepreneurship, we don't always have the right exact team that we need at the time. And so who better to find is usually a coach. So that's one type of flavor. The other flavor is that basically through natural inflection points in your career, you realize, I probably should not do this alone. I'd be stupid to do this alone. And so they're usually actually high performers. The people who come to us are not people who identify with something's wrong. they identify with this has got to be better or there has to be a different way. And that's when they decide I should invest with myself. I think the harder thing for most clinicians is, are they willing to invest in themselves?
Right? Because they think that in many respects, you think you should know it, and or I can figure it out on the fly because I've got all these other goals and people respond that I'm responsible to and whatnot. So, how do you get them past that? How do you get them to believe that there is a return on that investment?
So I think it depends on the person. So I think for some people, their goals and their aspirations are either very intrinsically motivated or extrinsically motivated. And so I think it depends on, for each person, what is it that's either most immediate for what their pain point is, or is it something deeper where they're missing sort of the deeper values that they no longer express. I mean, I still remember when I, with my own coach, had to discover my values. And it was really frightening because I suddenly at age 40 something, I didn't know any of my own values. And
Sure.
actually, it's only through that reflection piece, that slowing down piece, that you realize the story's been there the whole time, that the ideals of creativity that have been sort of put away in a box somewhere to do other things in a creative way needed to come back out again. And so I think in some ways it's just reflecting. Not many people do a retrospective. You may know also from project management and other agile sprints and scrum sort of philosophy, right? When you do postmortems and you do these things for projects, we often don't do it for our own lives, whether it's monthly, weekly, daily,
Of course.
yearly. We only do it for our projects, like our research projects, but we forget to do it for ourselves holistically. And that's what we start with in our coaching journey.
Sure, and
The first, yeah.
that can be jarring when people get into a position where they realize they finally do discover, okay, yeah, I can truly identify my values, and wait a second, my priorities have not been matching these at all, and
Right,
I'm up to here in it. So how do I
right.
reframe and reorient? So I imagine that clinicians come to you from all different angles in terms of, as you said, whether it's just in clinical practice, entrepreneurship, clinical leadership. That's a huge jump from a lot of physicians when you're going just from being a 100% clinician to now all of a sudden, you're an executive or a department chair. Can often be completely different skill sets, but I'm sure there are some, at least some themes. Everyone's going to have a different flavor, but there's some really, so what are like one or two like real pain points, the deeper things that are facing physicians or clinicians right
I would say one is just their own personal well-being, which is why we decided to try to put on my banner bar in LinkedIn. It's leadership plus well-being. Because I think all of us want a sustainable life. All of us in healthcare want to do this for the long haul. And the fact that the narrative for people to just do something completely different, give up clinical medicine, it's like cutting off some of our arms, right? There's always going to be a part of your heart that you spent so long and how you help people and how you serve either the greater organization of medicine or healthcare, or whether it's via tech or via research or via education, you're still always serving the greater good of the discipline of providing healthcare. And so the question is going to be is just figuring out how that will look like for you. So I would say that's probably one pain point. Like, should I give up? Should I leave medicine? Can I 100%? I mean, even look at me. I haven't fully given up medicine yet.
right
I find it very hard to actually give that part up. And
yeah
my part of our philosophy with our coaching philosophy is the opposite of what everyone else tells you, which is boundaries. Say no, more boundaries.
Hmm,
It's actually
interesting.
because awareness, new action, and deliberate practice. Because it's only through the action of learning and going into the new version of yourself will you decide, I will shave away and maybe you will end up leaving. But it's going to be a gradual journey. You don't just completely amputate the arm while you're going to go find a new technical skill, right? Or a new consulting skill or a new tech skill. You're going to sort of do a little bit of both along the way so that you can layer your expertise and get to where you want to be. So that's probably one flavor. I would say the other flavor is just there's so much emotional distress. And it does take a lot of emotional intelligence to be a leader. The generations are very different in their expression of emotional distress, and that really can affect the learning environment, the professional conflicts that we see, and the management of people.
So
And I
I'd
think,
love you to expand on that. Can you give me, just a few minutes on that, on the different
well, yes, I mean,
generations?
just generationally, if you think about people older than us who are actually retiring or dying, right? Above us, like older than us.
I hope there's more to it than that after us.
But when you think about it, there's a generation that's very different, right? And those were our mentors. Those are our professors, right? These are the people who I learned everything from, right? And then you start to realize, even so, I mean, I'm sure yourself too, you realize my mentors are no longer here in the space. I need to represent the specialty. I need to carry the history. What am I going to now be as a transition pivot point to continue the legacy and also encourage the next generation to participate? There's so much boundaries and saying no and being really protective of just what's close to certain generations, and also because of the technological disconnect, a little bit too much digital nativeness have actually created environments where it's hard to practice in person and to do things in person. We have found that interprofessionally, it's it's people get offended very easily and also don't have the skills in how to resolve them. And so they can sense it, but sometimes it's the resolution, right? So I think a lot of people are better at sensing like something's wrong, I'm triggered. Great. What are we going to do
What do I
about
do with
today? And how
it?
can we work together, whether whatever profession we are? And I also think that, and that's why we created Transforming Healthcare Coaching, was that we're not going to just only coach the physician executives. It's also about the nursing executives and the MPs and the PAs and the pharmacists. We are all together in this house of healthcare. How are we going to make this work? Because once one person is really, or one area is really not well, and we saw this in nursing with the attrition, uh, the way they were just being treated for, I mean, they still are treated in many ways in terms of violence, safety, and
Hmm.
compensation and staffing ratios, that it really affects the way it is going to be a physician. And so if we don't work together to make healthcare better, then we have a problem.
Yeah. So as we are living now with a span of generations of physicians who everywhere, those who are just sort of at the later stage of their career retiring, that was all paper, right? That was really before the advent. And now we have, as you mentioned, digital natives. So, one of the things about technology that we've both, because we've lived through it, and year after year, technology has been promised to solve all of the inefficiencies of healthcare. And especially now, as we move into generative and agentic AI, people are saying, okay, this time is really different. But what clinicians usually experience with technology is more work, right? And I think electronic health records are the example of that. So, why is that? Like, why does that gap exist between the technology that's been developed and the fact that it's not dramatically making the lives of clinicians easier?
I think no one has spent enough on the UX side, the user interface. I mean, if you think about how easy it is to order a Starbucks or something
Right.
at a local gas station to eat, by the time you get there, it's ready to go. I don't understand why the same technologies for mobile tracking, arrival to destination, and also ordering, where it's really easy to order, like my CAT scans on rounds. Why can I not just press a little touch screen? Because there really are only a few permutations of the CAT scan I should be
Sure.
ordering for a particular diagnosis. That's what the problem is. The interfaces have really been meant for a data extraction on the back end for billing and finances that is not been about the user interface. And so I think I'm hopeful now that we all keep talking about human-centered AI, that finally we'll have ambient AI that can understand us contextually as the humans, running around inside our care places.
Yeah, and I definitely want to talk to you a little bit about ambient AI because that seems to be perhaps a really big step forward. But, on this question do you think it's because clinicians either are left out of the UI, the user interface, user experience design, are they left out of it, or is it they're just haven't made themselves available for it?
I think it's a little bit of both. I think, a lot of people, I would say in the very, very front lines, I think they would volunteer to be on those committees if they thought there was some credit or compensation, right? Because as you probably, I
Yeah.
mean, agree, there's a lot of committee work and safety work, but there's not necessarily, helping with EMR. Like no one raises their hand for this.
Oh, it sounds awful to have to go to that meeting, right?
Right. Right. There's only a few people who recognize that I have to do something to make this better. And so they've always been sort of in that digital health space, but that's a minority of all of the general practicing clinicians. I think they don't feel, I mean, I guess it's one of those things where the product hasn't gotten improved enough yet for them to be a beta tester. So they just wait and they don't realize they should raise their hand.
Well, that's certainly one of the things that I'm hoping for is that by bringing people together in this space from all these different disciplines, that we can start to understand, okay, I believe if technologists really and truly understood the pain point better, they might have more insight into how to design this. Because the thing is, everyone knows burnout is a problem. Any division meeting or medical group meeting you go to, people talk about it. If you ask any of the stakeholders, they would all say, yes, we're applying resources to it. But it's still here, right? It still persists. So if you look at it from the other side, what are the real structural problems that are keeping people stuck here? What what epiphany has to occur to make this at least start going in the right direction? Because it's not.
So I think there are probably two factors. One is I think there's a lot of rigidity for how the structures of healthcare is delivered, that there is unwillingness from leadership often to pilot small tests of change for schedule autonomy or schedule delivery, and also understanding that people, any group, are always going to have illnesses, life, um, and that you don't schedule with some buffer. So because you run so lean from a human capital perspective, always that you're not willing to spend a little extra on the fringe to make it like people have some breathing
Right.
room, that they don't feel guilty that when you get sick, or you don't feel
Sure.
guilty. And then what's surprising to me is that we really have just swung back to that right after the pandemic. In the pandemic, we were very good about those policies because nobody liked having outbreaks within their facilities. But now we're sort of back to, well, you just don't call out unless you're deathly ill again, sadly.
Yeah, it's like it never happened in many
Right.
respects, except we have much fewer staff. That's the main thing, is that I think it did cause a lot of staff to say, you know what, this isn't for me anymore. And so we
Right.
still haven't recovered this, in my just anecdotal experience, we haven't recovered the staffing problems, but we've gone right back to the operational, kind of
Right.
issues.
Right. But that's only one half the story, right?
Yeah.
It's the structural problem, an inflexibility, and this is how we've always done it. And there's no small tests of change where the leader thinks about the well-being of the group first. Some groups do. Now, there are some very healthy groups out there where they do think about unit by unit, how is this going to be a true family who supports each other? And let's be creative and make decisions together given something happening. The
And
other half,
have you seen, like, how do they incentivize that, or how do they build that into the success? Because you would think of it, that should be a success metric, right? How engaged are your people, or
right?
how
Yeah.
much burnout have you relieved?
Yeah, I mean, it's a very democratic group, right? It's a group that's actually carefully selected for values, morals, and work. Also, willingness to speak up and co-designs and suggesting ideas and actually trying the ideas, right? Because I think I speak to many nurses where they would like, that's just not the way they works here, and the policy is very different for how they do scheduling as compared to the physician world. It is completely time and rank, or it is completely via seniority, and they are not going to change things, and they're too afraid to change the culture, even if it's going to contribute to toxicity long term. And then the other question too then becomes the individual burden, right? At the end of the day, I know people don't want to take responsibility, but the only thing you can do is your own responsibility. When people is basically say, I have greater control. I choose how this place affects me. I choose what I sign up for. I choose to find the goodness rather than the badness in
Yeah.
any moment, committee, work, additional burden. And it's also a choice to see from a different lens. And so we often help, we have assessments that help with diagnosing how your assessment, what sunglasses do you put on when you look at life. Some people are more positive, some people are more
Hmm.
negative. And with
Yep.
coaching, we do sort of help you change your numerical score, right? In terms of, is that the only way you can look at things? Okay, yes or no. And then we do sort of work on your mindset to some degree, because there is a little bit of that. And then at the same time, the reality is, at some point, if you don't care for yourself first and you allow work to run you over and you allow everyone else's needs to run you over, you're not going to be help to anyone at
Yeah, well, you,
home,
you
your own either.
mentioned you mentioned autonomy in there, and I think that's a
Yeah.
big thing that people feel as we have transitioned over the years away from as private practice being as much of a sustainable model to, people more and more becoming employed models for clinicians, certainly physicians. Speaking about that loss of autonomy, is real, and I think then that kind of gets to a sense of I can't control my environment, and I imagine you see a lot of people struggle with that. So, all right, we talked enough about the problem. Let's talk about some things that are working now, and I want to start specifically with your approach. So, maybe just tell me how you and your team at Transforming Healthcare Coaching are making a difference, and what can we learn from that?
Yeah, so I think the first step really is awareness. And so we have a different proprietary tools, energy leadership index for yourself. We do 360s if you want to work more on your team and your organization. We also do principles us and principles you personality test, which is a much more advanced version of the Myers-Briggs, just so you can understand yourself. And also with the principles us, how your team works. So that you can sort of decide like, okay, within this leadership team or within this group, there's some people who have this particular strength or this particular tendency, and we accidentally maybe cause conflict all the time and don't really realize it. And just having it out there transparently for the group allows people to be like, oh, you're just being you and I'm just being me, and we got to meet somewhere in the middle, and we can laugh about it now, and we just get past that. And so it sometimes in many ways diffuses like centuries old sort of like friction, so that we can just say, hey, we all want this to get better. And so how can we leverage some of our strengths? So there's some people who are very like sort of solo and sort of enjoy, you'll sort of recognize this. There's always that one person in the room who likes to be the canary, who completely says all like the things that are wrong in your team or organization. And we don't
Canary.
all,
That's a very judicious word.
but we need to in some ways thank them, right? And they're never thanked for their role in these
Good point.
organizations because they're actually pointing out what maybe no one else will point out. And meanwhile, there's the rest are just silently burning out. And so you need to have sometimes all of the disparities so that you can actually move forward together. What's hard, I think, is like most people don't spend the time to do this kind of teamwork assessments, really deep reflection. They often reserve these only for the C-suite. So like way up at the top and into the next echelon down, there is actually great cohesiveness. Like, I mean, I think of the executive teams, they're actually great. They're very happy together. But then as you go trickle down even further, it gets lost in translation because all you're just trying to generate all the reports and the data and monitor and keep everything safe, that you have no time to take that pause. And I think that investment is what we're hoping to change with transforming, to be able to begin to look at the assistant nurse manager. It's so stressful to become that person, that the associate or assistant program director, that's also a stressful time. They need care so they can get the skills so they can be sustainable. Once they're sustainable and begin to get their expertise, the rest will follow.
Are you finding any newer technologies are helping your actual approach? As you've gone through this over time.
Technologies, you mean in terms of from the healthcare
Yeah, or even
system?
just no, I mean in terms of, well, even from number one, your ability to assess and guide your clients. Are you finding that the data is more rich now that you're be able to use tools, or I know you're also and if I didn't get a chance to ask you about it yet, but that you're the co-director for the a fellowship in advanced clinical simulation,
Right,
right?
in
And so I would
simulation,
imagine
right.
there might be even some opportunities around simulation avatars and whatnot, where people can role play, so to speak, some of these conflicts that they're having as leaders, things
Yeah.
like that. Are you leveraging any technology in that respect?
So I'm actually not leveraging any technologies, although I do. My side interest is to be able to develop some of these things. My
Hmm.
hope is my side consulting thing and interest is I for my last 10 years of my academic career is hoping to create avatars that can help us develop better teaching skills, feedback skills,
Sure.
communication skills as just leaders working within a professional team. I think we often need a coach ourselves, even as we're practicing, just to kind of just be a mirror to ourselves and say, hey, you could have said that differently. Or did you
Right.
notice that their tone of voice was not quite right? That's, I think, the question is whether or not any more ambient listening can, like right now, we're so focused on making the chart and the care delivery good. I'm more concerned about the people in healthcare, all the people who are delivering care. How can they become more relaxed and get the care that they need?
Sure, and not feel like we're one person away from this whole thing falling apart. You're leaving from one,
Right. Right.
because that's always
Yeah.
out there. Okay, well, I want to give you an opportunity to speak to two audiences here and to really highlight, why this is a problem, not just because addressing clinician burnout is the right thing to do. I think we all can acknowledge that, but why it actually makes good business sense, because let's be real, there has to be a return on investment for anything that we do in healthcare, or else it's just not going to happen. So I guess the first group would be the healthcare leaders, health system leaders, payers, organizational stakeholders. If you had a chance to sit next to one of them at a conference and make your case for why this is really important, what would you say?
Well, very similar to, with your clinical practice in cardiology and trying to prevent a lot of things from happening, I really see coaching to be preventative. Rather than spending all of your money on the EAP, therapy, well-being programs, exercise, like that's not where the money needs to be. To me, the money should be in giving people access earlier in their career inflection points to normalize coaching for all professions simultaneously, because then we begin to think of the healthcare professionals themselves as supreme athletes, right? We don't do this for we give an entire team of coaches to athletes, right?
Sure.
Teams. Why do we not have that for healthcare? And that's what I think needs to change, because that would prevent people from having an existential crisis 10 years into their career and be disgruntled with autonomy because they have misalignment of their values or didn't get an opportunity to go pursue growth, right? All humans want to grow. When we stop growing, we die. And so as organizations, the humans in caring for people are not widgets. They're not commodities. There are people who need to be nurtured. And when they're nurtured, it just comes out. They can't, the general tendency of all healthcare professionals, they love to care for people. You give them an opportunity to care, they go do it. So because that exists within your healthcare organization, they're just going to naturally gravitate to go find some new thing to take care of. And so when you invest in the people and you give them the right alignment of where they can grow in your organization, you have retention, you don't replace
Attention.
people, and you have greater safety. Actually, right? We know that burnt out clinicians have greater errors, cause more problems, and are very
Absolutely.
costly to replace.
Absolutely. Great point. So, how about the other group would be the technologists, the engineers, the software developers, not so much from doing what you're doing, but the people who are developing the technology that the clinical workforce is going to be interacting with. Kind of like we talked about earlier with the user experience. What would you say to them in terms of either getting them more interested in this space, or sort of adjusting their approach or giving them some insight to make it better, not just for the bottom line, but actually for the clinicians who are having to use it.
Right. For obviously user interface is often perceived as the last step in a product design, but the reality is I think it should be flipped, right? So oftentimes we're trying to solve a technical or a math or an analytical problem in a logic stepped kind of situation. To me, it's the opposite. If you make it human centered first, how can we still keep care human centered, teamwork human centered, teaching human centered? And then from there, look for ways you can optimize. Like this is how humans interact. And how can we keep that and make it so easy that all I have to do is suggest an idea and a little avatar comes up and offers the correct solution and it is done. I could do a verbal cross check, right? Because verbal cross checks we know are good for patient safety. Like,
Mhm.
did you really want to order that CT scan? Yes, I did. And then offer also even opportunities to pull from the internet the reading that's associated with it so that we don't become stupider, right? As clinicians. We actually want to know what it is that so I think when we design the bot to be friendly, encouraging, human centered, knowledge developers, people developers, that too will change. Because right now, I do think most people are focused on solving like a digital problem and not necessarily a human problem.
Correct. And I think that's a great point about that's what EHRs did. I mean, of course, they're getting better, but EHRs solved everything from an administrative standpoint. But when you actually had to use one, it made your life so much more complicated. But we are getting there. So from where you stand now, just to kind of close with a reflection, the work that you're doing, the problems that you're seeing, the things that are working. If you had a magic wand and could wave it, what would be better, measurably better in say 3 years from now, if either health systems, technologists, or the all of the stakeholders got together and said, all right, we're going to really tackle this problem now, and we're going to start with this one thing, and we're going to guarantee it's going to be better in 3 years.
I think a lot of it has to do with flow, right? Because I think there's a mismatch of flow when people come in, people get overwhelmed, and there's other times when it's completely not matched, right? There's lull times and we don't know when people will come get care. So if everything actually matched better so that there weren't bottlenecks in cleaning, throughput, personnel staffing, right? Like if you just knew I could come to my shift, I'm going to have 1 to 4 patients. It will
Right.
come at this cadence. It will all go well. And if there's a slight emergency, the system can handle it,
System
but
can
it's
handle
not
it.
these weird influxes of matching and flow states and boarding. And if everything could just flow from all the way when something happens, all the way to care is delivered, and then right back out again, that would be a pretty amazing thing, right? Whether you're inpatient or outpatient, everybody has a flow issue at some point, staffing issue. They're all interrelated. If that could happen, that would be amazing.
And what you see is just the easiest first step towards that anyone listening could take tomorrow.
Ooh, I don't know. I think there does have to be a better, I think, digital dashboard. It'd be exciting to see whether they're going to analyze. I mean, we know like in certain pods, there are the inputs, the in department and out department, but they're interdigitated. It'd be nice to look at, because I've thought about hospital flow a little bit coming from EM and critical care. It would be interesting now that we have a much smarter AI technologies that can do so much more analytics, is now look at from not just this system, but the interdigitated spoke and wheel and hub, right? Like we know that we're now a system of 20 some hospitals. How is it different in each of these? And what are the phenomenologies? So we can sort of look at the digital phenotypes and understand, well, why does this one have a bottleneck here? And this one is a bottleneck here. And then where does that translate to? So I think then you can sort of begin to harmonize why, because then maybe that's where the solution is. Like some places are doing things really, really well. Don't give up on them. Don't stop doing, and don't make it a one size fit all, but begin to try to see where the patterns are right now in multiple buckets of data.
So if someone out there is listening and they're either a clinician or a health system leader and say, all right, we got to get around this. She's giving me religion now. How can they get in touch with you? What should their first steps be?
I'm mostly on LinkedIn, actually. So you can find me on LinkedIn and just literally reach out just the way you reached out. I love meeting people on LinkedIn. I think it's been, again, a great thing for technology because you just meet people of interesting thoughts and see what people are up to, and also amplify people who are in the similar mindset where you can sort of tell, like, are you more about the status quo and how it's always been? So LinkedIn is one place, or you can find me at hello@transforminghealthcarecoaching.com is our direct email.
Wonderful. Well, thank you so much. I could have talked a whole other hour of this because everything you've described, I've lived through personally and seen in my colleagues. And, fortunately, I have a great team of people I work with, but, it's still hard. It's hard to maintain team cohesion. And it's always great to reach out to peers and coaches. So you're doing fantastic work, and we're really grateful for it. And thank you so much again for being on the show. Appreciate it.
Thank you so much for having me.
All right. And thank you very much all for listening. If you like what you saw, please remember to share this with someone who might find it interesting as well, and check back with us next time. Take care.